Okay, today we're going to do wet to dry dressing changes. Always remember to do universal precautions whenever you have any patient that or you're handling any kind of secretions such as blood or respiratory secretions, vomit, things like that. And that means gown, mask, goggles, face shields, gloves. Also remember white cap. You'll need to do that also for checkoffs. We want to make sure we ask the patient if she would like to be pre-medicated with pain medicine prior to the dressing change. And if so, then we would give it to her, and then in about 30 minutes to an hour, we would come back for the dressing change. This has already been cleansed and my hands have been washed. And now we're going ahead and we have a bag here, and make sure it's opened up fully so it's easy to drop stuff in. I'm going to, in order to take off the dressing, I'm going to put on a pair of clean gloves. All right, so now that we've got the wound available, I'm going to take off the dressing, and I'm going to make sure I take it off in this direction so that the patient cannot see the wound or the blood. And then I'm going to take a look at the dressing, and I'm going to assess it for blood and serous or sanguineous or serosanguineous fluid drainage, and then it could be green. Does it have an odor? And then once I look at that, then I will throw it in the trash. And I'm going to go ahead and take off these gloves at this point because we've just removed a dressing. You always take off your gloves after removing a dressing. And I'm going to go ahead and alcohol my hands good again. And you may put on gloves at this point, or you do not have to. Just make sure when you go to open this, do not touch inside the sterile area. You open away from you and take this completely off. And remember, this only the outer edge can we touch with our clean hands. Okay, and I'm going to grab the sterile gloves. This, we're not going to use this, we're just going to put this here. And today we are not going to measure the wound, but if we were going to measure the wound length, width, and depth with the Q-tip and the measuring device provided, we would do that now with clean gloves. So now it's time to put on our sterile drape to set up our sterile field. So I'm going to grab from this corner with my clean hands. Be careful not to hit your stomach. Now, any part that falls below here, below the table, is not considered sterile. You should not reach across a sterile field like this. And only this part, there's a 1-inch border around this, all the way around, that you may touch, but only work inside the border with sterile items. So now with my clean hands, I'm going to apply some sterile Q-tips to my sterile field. And you open away from you. Did I drag that? I drug it. So what would I do? I would restart, and I would have another drape, and I would restart the process. And if in checkoffs, if you drag it, you would ask to restart the process. Okay, so now I've put them down without dragging it. So now it's sterile. All right, so now I'm going to open up my gloves. The rest of the procedure is sterile items. And so we're gonna open it up on this side of the table. Might push this a little bit. Fold this part out. And fold this down. And take this. And open. You're working with a little bit of space here. And then you take your dominant hand.
Okay.
All right, so now we can either we can get rid of this or we can leave it there. It really depends on who you work with, what they like. You will see a lot of people, if you don't have a trash, you can just put it on the floor, but some may not approve of that. So you really just need to do what your hospital and doctor would like for you to do. It's very important for you not to turn your back on the sterile field at this point. To see this blue line, that is where we handle this dressing. And we drop it. And when you go to get out the water, be very careful. Remember, you can touch anywhere inside here because it's sterile to sterile. You can take this and then I palm the label, and it's already open, but you could open, since this one is already open, we would pour a lip. We would lip it. Okay. Okay. And I would, if at this point, since I've already opened it, just go ahead and put it up like this. That's where you're gonna use it. Okay. And then, and we are going to use 3 for cleaning the wound, 3 for drying the wound, and 2 for packing. So I'm gonna take 1, 2, 3, and 1, 2, all right, that's 3. Okay, and now I'm gonna take this out. Okay, so now we'll take this, because this is what I'm gonna pack it with. I'm gonna go ahead and take it out and kind of fluff it out so it won't, it's easier to do this when it's dry than when it's wet. Okay. So now I'm going to pour this over. this point, we could throw the water away if we wanted to, the sterile water, or normal saline, this is. Okay. And then you squeeze these out. And start with one. And we start with the proximal side to distal, down the middle first. And then we go to the furthest away, the side furthest away from us next. And then the side closest to us. Be careful not to turn your back on the sterile field. Okay. And at this point, now we will pack our wound. And I like to use this side because I feel I have more control. Sometimes I feel like the cotton tip gets caught in here. And you have to be careful that this cotton tip doesn't come off in the wound, but it will be softer on the patient whenever you go to push in there. You don't ever want to push too hard. Make sure that's be careful not to push too hard. Now, I'd be very careful not to drop any on the skin around the wound. If you do by accident, you can just say, I contaminated my wound and may I start over. And at that point, your clinical instructor will let you know if it's okay to proceed or if you need to start over. So at this point, I'm going to now cover my wound. Can you stop it for a second? So, and since this is a wet to dry dressing, this is really the nurse's preference. I chose not to dry the dressing because it is a wet to dry. But if it were a dry dressing that we were going to put in and not a wet, we would definitely want to make sure we dried down the middle and on each side. So at this point, now we will put on this. Or you could use a couple 4x4s if you didn't want to cut it. Okay. And that is the wet to dry dressing. At this point, I can take my gloves off. The sterile part is done. If I would like, I can leave them on. I prefer to take my gloves off when I put tape on because they stick to the patient. At this point, I would tape. I like to use paper tape because it's easier on the patient's skin. This is what we have for checkoffs, is the IV tape. You will use whatever your hospital and doctor recommend. And I would take an indelible marker at this point, and I would initial time, date, and initial the dressing. And then I would go to my chart and I would document the time that it was changed right now, the current time, and how the patient tolerated the procedure, and make sure you put the wound measurements in there as well. And that's
Go.
And don't forget to document the drainage as well, the color, the consistency, if it's sanguinous, serasanguinous, green, the amount, and if it has an odor. Okay, thank you.